In this video, we'll discuss several misconceptions that we hear all the time from clients here at Reload about knee pain. One common misconception is that my knee pain means something really scary is going on and that imaging is necessary. So most of the time, imaging is not actually necessary for knee pain, with some exceptions. So if there is a lot of swelling around the knee or a major loss of range of motion, you're unable to weight bear on that leg, or some other things, then we may dive a little bit deeper, and sometimes we do recommend getting imaging like an X-ray or an MRI. However, in most cases, it's really not needed in order for us to do what we need to do to get you back to the activities that you want to be doing. So during an evaluation, we're determining what are the positions or movements that are painful for you and what sort of things can we do to help make those things better. And specifically, those are things that are linked to your valued activities. Another common misconception that we often hear is if there are positive findings on imaging, do I need surgery? So positive findings might be something like a meniscal tear or degeneration. Most of the time, these kinds of things do not require surgery. In fact, if you have something like a meniscal tear, many studies have shown that the outcomes are similar if you have surgery or if you go to physical therapy. And in fact, if you have surgery, the downside is it's very common to have early onset accelerated osteoarthritis. There are some instances where surgery can be beneficial and even recommended, but in most cases, it doesn't hurt to give physical therapy a try first. You may end up finding that surgery is not necessary after all. Many people who come to us believe that when they have knee pain, they should avoid exercises that involve their knee. Oftentimes, this is after their physician has actually told them to stop squatting and to stop lunging, that those movements are actually bad for the knee. But this is not a long-term solution. So we need to be able to squat, to get up and down out of chairs, and to go to the bathroom. So finding ways where we can strengthen those muscles is really important. It might involve something like isometrics or holding exercises, which tend to be a really safe starting place and things that we can work really hard but recover from very quickly. It might also mean taking those same movements like squats or lunges and making it a little easier on you. So maybe offloading some of your body weight. There are creative ways of doing that to make the movement more tolerable and in a way where you're feeling those target tissues working. Eventually, we need to get you back to doing those things that you were told to avoid, like squatting and lunging, because they're a component of your everyday demands and very likely your valued life activities. Another common misconception around knee pain is that you only have to strengthen the muscles right around the knee. And while that may be a major part of your rehab, it is also influenced based on how the foot and ankle muscles are functioning and the muscles from the hip and above. So we want to look at how your entire body works together, which will also include elements of recovery. So your nutrition, your sleep, stress, all of these factors can influence your pain experience. Here at Reload, even if you're coming to us for knee pain, we're looking at you as a whole person. So we want to understand what you've been through, what your goals are, what your obstacles and frustrations are. Together, we want to come up with a plan to get you back to those valued activities.